I'll just talk a bit about what's happening to the NHS and maybe what we need to do about it. But how have we got to the point where Stroud Hospital is leaving the NHS? And as you know, as probably most of you know, myself and other people in this room are the Green Party members, John and Gerard, and a whole bunch of people involved in Stroud Against the Cuts fought a really big campaign to stop that happening, to stop Stroud and the other 8 little hospitals in district hospitals in Gloucestershire leaving the NHS. And we were successful. I mean, it was a hard fight, and we had to work with the staff. And that was also when I first came into contact with the Green Party, and it was a real joy working with the Green Party people who I think were really great at grassroots campaigning as a party. Really able to be quite nimble and just talk about what's going on locally and what's important locally. So we won the campaign. I mean, it was a fantastic introduction for me to Stroud to see, I think I worked out it was like 5% of the population of Stroud, 500 people in this little town marching down the streets for an issue that was actually quite complex. They were saying, oh, it's not really privatisation because it's a social enterprise, and it's not that the hospital was closing or anything like that, immediately at least, but all of these moves were going to make it more likely in the long term, I think. So people really mobilised, and it was really good to see that in this town. And I mean, to be honest with you, we won that case, we won the campaign for a variety of reasons, partly because we got excellent lawyers involved, and we found a legal loophole in the process that they'd messed up. They'd been quite arrogant about how they'd gone about it. They hadn't bothered consulting people. They hadn't really bothered checking if what they were doing was actually lawful, and it turned out it wasn't. Although we won their legal case, or rather we sort of stopped them in the High Court, we wouldn't have got what the ultimate result with that hospital, which was keeping it in the NHS, if we hadn't also put loads of pressure on the local MP, to really sort of stop just coming out with platitudes like, I like the NHS, and stuff like that, which is what he said to me next year. And say to him, are you going to support the NHS staying at the local hospital, staying in the public sector? And he was put under a lot of pressure by Stroud News and Journal on that. And we really needed to kind of pin them down, because you hear a lot of double talk on all of this, I think. I've just realised that I'm going to go on because this watch is not actually working.
2 hours later.
Yeah, I've been talking more than that. Thank you. We needed to put a lot of pressure on politicians, and it was really informative for me. I thought I knew about politics, but to see how decision makers wanted to hide behind each other, no one wanted to take responsibility for these decisions. And one of the things that was kind of used to floor us quite a lot of the time was the managers saying, well, this isn't a new policy, this is something that's happened because of the policies that were introduced under the last government. So in all of this, in the end, Carmichael was put under a lot of pressure, and the government had to sort of change their procedures, and we were told we were allowed to keep our hospitals in the NHS, and it was fantastic. But I had to sort of, in the course of that, I suppose I really had to educate myself about how is all of this possible anyway? How have we got to this state? So I did a lot of reading around. I mean, just very briefly, because it's hard to talk about the NHS otherwise, I think. So, a bit of history, that in the early 80s, Thatcher introduced the market into the NHS. She introduced this thing called the purchaser-provider split, the idea that the market would make everything great, that we'd have the people who held the NHS purse strings, and we'd have the people, the hospitals and whatever that provided the services, but they would be separated. And initially it was just mostly an internal market, so it was mostly NHS hospitals doing the providing, although right at the start some things were privatised quickly, like cleaning, and of course when you start thinking about all the things like the hospital superbugs, it was quite clear some of the implications of that decision were really flawed. But it was mostly the sort of non-clinical stuff that was privatised to begin with. When Labour came to power, they sort of reversed that for a few years, but they then went back in a different direction, and they brought in more of the market under Alan Milburn. They signed something called a Concord Act with the private sector, the excuse being that we needed to get waiting lists down, and we needed to increase capacity so the NHS would fund people to go and have treatments in private hospitals. And in some cases that we would build private hospitals or private clinics to do some of the kind of easy surgery, like hip operations and stuff like that. And a lot of money was given to them. Very debatable whether that was a good use of money, really, or whether we could have got waiting lists down a lot more cheaply by doing it in the NHS. A lot of very bad value contracts were signed, dwarfed probably by the bad value of private finance initiative, PFI, where, you know, there was a big accounting trick. Gordon Brown wanted to show that he could keep all the money off the books, and you know, we took out very expensive mortgages essentially to build all these hospitals that we don't own, and we're tied into very expensive maintenance contracts. Huge, you know, I think Alison Pollock, a real prominent critic of it, says it's buy, what is it now? Pay for 3 and get 1 is what we do with PFI. Yeah. Other bits, you know, pathology, all sorts of the backdoor bits, you know, the bits we don't really see, the testing, lots of those began to be sort of hived off to the private sector. And foundation trusts, hospitals were kind of made these standalone, semi-business kind of organisations that some of them started to become. Oh, and I think quite importantly, actually, with some of the stuff that's happened lately, the out-of-hours stuff that's been in the news quite a lot with 111 and all of that, that was all messed around with. It was taken away from GPs so that, again, it could be sort of opened up to profit-making companies. So that's kind of what happened under the last government, you know. And I think it's been quite confusing. For part of the reason I think the narrative's been quite confusing for people about what's going on is because, you know, that's not a very... It's quite difficult to tell the story of why the Tory legislation is so terrible and exactly what it's doing without being honest about what happened already, you know. And in all of this, I would say, from, you know, I remember John gave me the Green Party's health policy, and it's unequivocal that, you know, in health, public ownership is what we need. And I mean, all the evidence, you know, there isn't any evidence. Even NHS England, they were going to write some guidance about how competition was in the patient's benefits. And they said themselves, there's a paucity of evidence. It just, you know, you don't have a market in health because we don't have the level, it's not like going to buy oranges, we don't have the level of information to assess whether that's a good operation or a bad operation, and it's a bit more serious than if that's a good orange or a bad orange. So that's why markets don't work in health, and that's kind of just well established. So the Tory Act did a whole bunch of other stuff that made it worse, basically. It increased the amount of private income that hospitals, that foundation trusts could earn to half of their income, so increasing the likelihood that over time people will be able to people will be more likely to be able to pay to jump the queue, still to be treated in the same hospital, but as a private patient. They, very importantly, abolished, and this hasn't had much coverage, they abolished the minister's duty to provide a universal health service that had been there since 1948. So they no longer have that duty. In fact, the government's really quite hands-off now, and all the power supposedly has been, or all the responsibility has been given to these local clinical commissioning groups, which is why the Act was sort of badged as giving power to GPs. You may have heard some of that spin on the radio. But the CCGs, the GPs, they only have the responsibility for people on their patient lists. So there's a lot of possibilities for people to begin to fall through the gaps, and especially as it becomes easier through other changes for people to be excluded from the lists. What a lot of people suggest is that this whole structure is really set up to be the final stages in the move towards an insurance kind of scheme. And although you can't see it happening yet, and there's strong denials, there's little things going on with personal budgets and top-up payments, where you can begin to see how we make that shift to an insurance model. If we don't have a government that has a legal state responsibility to provide our healthcare, we're going to have to start looking elsewhere for it, and actually the structures that are in place are structured a little bit like that already. That's probably a bit unclear, and maybe that will come out a bit in questioning. But what I think is quite interesting is that when you hear politicians questioned about the NHS, one thing that they do not very often say in all the three big parties, they won't commit to a tax-funded NHS very readily. They'll say all sorts of nice things, but actually the idea that tax-funded NHS rather than some sort of insurance scheme is way more cost-efficient than anything else, the language is suspiciously slippery around this, I think. So I probably need to kind of wrap up because I realise that time is marching on and I said I wanted to leave lots of time for questioning. But that's just a bit of a whistle-stop history. I mean, one or two things I just wanted to mention about what's going on locally. We see a lot of this playing out locally. So we've got, at the moment, district nurses locally, and in fact most of the community services that we campaign to save are going through a great big upheaval. Every time there's an upheaval, it becomes easier to argue that it must be tendered out, that it's all very new and different the way we're doing things now, so it must be opened up to the private sector. We've also got a lot of pressure on, this talk of care going out into the community. I don't know if anyone saw David Nicholson on Newsnight last night, the outgoing chief executive of the NHS. He was talking about smaller hospitals, care closer to home. I mean, it's not necessarily the most efficient way of doing things, given that we've also got £20 billion of cuts being made. And what's happening locally, I mean, I spoke to a district nurse who told me that care going out into the community, what that actually means is care going out to mobile, isolated staff who are paid less, who are less supervised, who are under poorer terms and conditions, who are administering drugs in people's homes, which are quite dangerous in quite distracting circumstances, But this is also, it's a lot easier to privatise, and I think we have to ask serious questions about some of the rather woolly talk that we're being given about care. I mean, we remember what happened with mental health care in the community, I think, and how that care just wasn't there. So that's one example. Another that I just wanted to touch on really quickly, because I think it's important in terms of what we can do, is Arriva, the bus company, now runs our non-emergency ambulances in Gloucestershire, and a whole bunch of other counties nearby. They've got a £50 million contract to run that. You may have seen in The Citizen there's been all sorts of problems, elderly people being left for hours on end, while these low-paid bus drivers are not turning up, and they're shocked to discover that Gloucestershire's roads are quite rural and stuff like that. That was one of the excuses. We've got the opportunity, at least through our councillors, to be asking questions about this. I'm told that Green Party doesn't like to be negative about other parties, so I will try and refrain from commenting on the failures, really, of the scrutiny committee that's supposed to be asking questions about this. But I think we do need to make
Point of information, Chair, some of us are not quite so fussy about that.
Thank you,
Yeah, we need to press them really on that stuff. And just lastly, because I'm over time, but I think the other thing that I think is really valuable about what the Greens have got to offer to this debate, because it can get really depressing. I mean, I spend my life looking at this. It can get depressing. We're told that it's more expensive and blah blah blah. I think the Greens are willing to challenge the kind of the sort of conventional thinking a lot more. I mean, I remember hearing on the radio that there were 3 big things that the NHS spent money on: buildings, drugs, and staff. And they said, and we couldn't possibly spend less money on buildings or on drugs, so we have to spend less money on staff. And it's that kind of crazy thinking that I don't think anyone in this room would you can all see why that's crazy. And stuff around prevention and stuff around, this was a big, everyone knows that we need to get around, why is diabetes such a great cost to the health service and all of these kind of areas, and that's where, again, there's a lot of sense in a lot of what the Green Party has to offer. But I'd like to wrap it up there. Thank you.